Kuwait's Merck, Sharp and Dohme held a press conference in which the leading pharmaceutical company announced the launch of its educational campaign about these sandstorms in Kuwait and their effects on health. April is commonly known as the sandstorm month, as this is usually the most affected month of the year for these sandstorms. More on this report by our correspondent Ghanwa Jabouri.
Merck, Sharp and Dohme Kuwait held a press conference to discuss the impact that the sandstorms have on society. As part of their ongoing commitment to raising awareness of key health problems that affect the local community in which they work, MSD launched an awareness campaign to educate society on the serious dangers sandstorms pose. The event brought together medical and environmental experts who discussed the causes and dangers of sandstorms, while also offering people invaluable advice on how to protect themselves.
So today is more about educating the public about sandstorms. What are sandstorms, how they start, what are their consequences in terms of impact on the society, impact on economy, and impact, most importantly, the impact on health. How to deal with the sandstorms, or how to avoid them first, and how then to treat diseases related to sandstorms like allergic rhinitis. So today is all about educating the public. So it's a prevention instead of cure.
We all live in these sandstorms or dust storms, and I think the main issue that we see in our clinics and in the hospitals are the health impact of that. So what we are facing are our patients who are complaining of allergy symptoms, whether it's an airway, upper airway, or it's an asthma-like symptoms, immediately after the attack of a sandstorm. We've seen this clearly 2 years ago after the event had in March 2011. We've seen it last year, 2012, during the season of allergies, which is March, April, has been the peak of allergies. And most of these symptoms, when they encounter us in the clinic, we diagnose them with doing some allergic investigation. We diagnose them with clinical symptoms of allergic rhinitis and or asthma, bronchial asthma. So what we have seen is that there has been an increase. As I showed you in the data, there has been an increase of about more than 8,000 patients visit during the month where we had that sandstorm in 2011 compared to the year before and the year after. So apparently there is a medical problem that we are facing. This is a reflection of the sandstorm, or the environmental change. Environmental change, we cannot control this, but what we can control is increase awareness among public and among patients about the health implication of allergic diseases.
Sandstorms are a major cause of bacterial and viral infection, in particularly amongst those with weaker immune systems, such as the elderly, according to the experts. The awareness campaign, which is supposed to run over the next few months in line with Kuwait's sandstorm season, will provide important information to society.
In this press conference, we try to find a solution for one of the major problems, natural problems, which is the dust storm. And indeed, in the recent years, we can see from the graphs that there is an increase in the number of the days for the dust storms. And actually, it's not a local problem, it's a regional problem, it's an international problem. So locally, we should find the solution. This is what Kuwait doing to find some solutions by the Green Belt. It's a big project. It's and the national parks and the land use try to find the best ways to use the land.
Kuwait faces up to 26 severe sandstorms each year, which have consequences, such as bringing traffic to a standstill, not to mention the health risks they can have on individuals. Today, this conference addressed issues on how one can better protect themselves. This is Ghanwa Jabouri reporting to you from the Marina Hotel for the English News.